Can CBT be adapted for different cultures? Imagine walking into a therapy room where your background, beliefs, and traditions are understood and respected. That's what culturally adapting cognitive behavioral therapy can do. Cognitive behavioral therapy, or CBT, is based on the idea that our thoughts, feelings, and actions are connected. Changing negative thoughts can improve how we feel and behave. But culture shapes what we see as normal or abnormal, how we express emotions, and what coping methods we use. So, adapting CBT for different cultures means tailoring it to fit these cultural differences. This process involves understanding a client's cultural, religious, and spiritual beliefs. Therapists learn about the client's values and social norms to connect better. They might change how they explain concepts, using language or examples that make sense within the client's cultural context. For example, instead of using Western-style metaphors, they might use stories or symbols familiar to the client's culture. Adjustments also include addressing specific stressors or traumas that are unique to certain groups. For instance, refugees might face different challenges than others, so therapy would focus on those experiences. Respecting cultural norms about emotional expression is important too. Some cultures encourage open sharing, while others prefer more reserved ways of showing feelings. Therapists often involve family members or community leaders if it's appropriate, because in some cultures, mental health is seen as a family or community matter. Training therapists in cultural competence is key to making these adaptations work well. Research shows that when CBT is adapted to include cultural values and beliefs, clients tend to respond better. They find the therapy more relatable and acceptable, which leads to better engagement and outcomes. These adaptations don't change the core principles of CBT. Instead, they make the approach more relevant to each person's background. In practical terms, this means using language that feels natural to the client, addressing culturally specific stressors, and respecting social roles and norms. For example, some cultures may have specific ways of expressing emotions or dealing with conflicts that can be incorporated into therapy. Overall, yes, CBT can be adapted for different cultures. Doing so helps make therapy more effective and meaningful for diverse populations. It's about respecting differences and making sure the therapy fits the person, not the other way around.